Many chemotherapy drugs can also cause nausea and vomiting, and we would always give patients an anti-vomiting medication before they get their chemotherapy, because we know there's nothing worse than feeling nauseated if you don't have to. Chemotherapy can also make your hair fall out, but at the end of treatment we would expect the hair to usually grow back, sometimes thicker, sometimes curlier. Different chemotherapy drugs can have other specific side effects depending on what the drug is as well. So usually before we give anyone any sort of chemotherapy, we would sit down and talk about the drugs which we're about to give them, so that way they can anticipate some of the concerns, and that way when it happens they'll know what to contact the hospital for and what might be happening and how long that'll take to get better. In addition to the conventional types of chemotherapy, increasingly we're using more targeted agents. These are things called monoclonal antibodies or small molecules, and they're very clever new drugs. Traditional or conventional chemotherapy works in a very blunderbuss fashion. It's like trying to hit a grain of rice with a cannonball, whereas the new agents tend to have more of a focused lock and key type mechanism. As such, they've got a very different spectrum of side effects,